So last week when Dr. Dokase asked me to present her RHD and Scabies data, I agreed to do it because I thought it was in a doctor's lunch hour meetings at my hospital, and we had that every Wednesday. And then a few days ago I found out it was a symposium outside of Viola. And last night I saw the program for the first time and realized the entire region is going to be here. So while it was very exciting, I suddenly forgot everything Dr. Doe wanted me to emphasize today. But today I'll talk very briefly on just our national ARF and RHD prevention program and local RHD and Scabies data, along with some achievements and challenges we've had along the way, and also linking RHD and Scabies. So as we heard before a few times, in 2003 there was a cross-sectional prevalence study including over 5,000 primary school students that was conducted here in Tonga. And what that showed was an RHD prevalence of 11.5% in all children that were aged 10 to 15 years old. And given this high disease burden, Mamafu Sai, which literally translates to Good Heart program, was inaugurated to address this in 2008. And this was done by Dr. Dokase Kaitao, who remains the driving force behind this campaign. So in 2008, initially only the students in class 6 were being echoed, and they were done by visiting sonographers and cardiologists that were coming to help, and also with the help of local RH and NCD nurses. At that time we had 2 portable echo machines, and the rest of the classes 1 to 5 were being auscultated for murmurs. If they had a murmur, then they were echoed as well. But then they found that by the time the students reached class 6, they presented with severe RHD, some failure needing surgery, and then this changed the whole approach. And so currently, every student from class 1 to 6 is being echoed. So over the years, some local sonographers and also some medical officers has been trained to do this echo screening, and we now also have 4 echo machines that helps with these screening programs. Currently, as I mentioned before, we echo screen every school every other year with a target of 7,000 to 8,000 per year. So half of Tonga and some half of the islands are being screened for in the first year, and then the next year the rest of the half and the remaining islands are being screened. So basically everyone in primary school years gets screened 2 to 3 times during this period. This slide was just put up to show some local pictures of local sonographers conducting the echoes starting from 2017. Throughout the years, it was noted that RHD was more prevalent in classes 4 to 6, which is roughly those that are aged 9 to 11 years old. And this is consistent with some of the other data we've heard throughout that day. And this shows RHD prevalence, including adults over the past 12 years, showing that it has been reduced since 2008. So from 2008 to 2019, a total of about 60,000 students were screened in which 40,000, or 72.6%, were echoed, and it showed that 4% had RHD, which were mostly mitral valves, and about 90% of these children had mild rheumatic heart disease or were asymptomatic. This screening program also picked up those that had borderline RHD, and for the borderline cases, they were re-echoed in one or 2 years, and were able to also identify some of the congenital cardiac cases. So this is just showing again that from the 12-year period that I mentioned, 60,000 children were screened and 40,000 were echoed. And so the participation rate by year has been good so far, and there has been a good turnout. And just some of the positives from the screening, though there is a lot, but this was just a few that I could think of. So this screening program, or this multi-site screening, allowed better planning and management for children with RHD. So through this, we were able to identify those needing secondary prophylaxis and also those needing early surgery. Also have reduced the number of children admitted with heart failure and ARF, and have decentralized health services. So those needing Benza were receiving it at the health centers, which opened till 8 p.m. on certain days, and this was very ideal because school children were able to go after school for their Benza injections. And just a few problems is again lack of resources and sustainability and funding. So for scabies and skin infection, this picture just shows, this was taken from the old screening form that was used initially, showing that we were screening for scabies. So we were collecting the data but not really analyzing, probably because we didn't think it had important link to RHD. But then this year we were very fortunate to have Dr. Simon and his team from Auckland Uni join us and conduct the study of scabies during the screening this year. So the study included 4 primary schools in the west of Tonga, and these were the research questions. What is the prevalence of scabies in Tongan school children, and also whether scabies and bacterial skin infection are associated with valvular heart diseases in these Tongan children. So the skin was examined using the simplified IACS criteria that Dr. Lucia mentioned earlier, and the data was collected electronically. So they performed a cross-sectional study examining skin of arms, legs, and torso for crops of papules which would be suggestive of scabies, and also looked at impetigo or other bacterial infection. They were also asking whether there was any history of an itch or pain that was present. All the skin lesions that were abnormal, photos were taken for further analysis. So altogether, they examined 400 children, in which 4.5% had rheumatic heart disease. There was 44.2% of these children having papules, indicating scabies. There are also 20% with impetigo and 12.5% with other bacterial infection. So this graph just shows the close association between RHD, those that had bacterial skin infection, impetigo, and scabies, and also those that had a history of having itch or pain. So the findings was that infection was indeed strongly associated with RHD with a risk ratio of 3.5. So those that had infections, they were 3.5 times more likely to have RHD, and for those with scabies, they were 2.5 times more likely to have RHD. And with a population attributable risk of 40%, and if we are seeing the causal association, that would mean that 40% of the RHD cases would be prevented if scabies were removed. But maybe more data would show a much more significant association. There's also a very strong association between scabies and other skin infection. And one of the child had a skin scraping, was sent to Lab Plus, and came back positive for skin scraping, for scabies. So WHO population recommends that if the prevalence is more than 10%, then NDA with ivermectin would be ideal. And so overall, itch, scabies, impetigo, and infections are all common, and scabies and infection, as we all saw, were strongly associated with RHD, and a population treatment for scabies would likely to reduce the incidence of RHD. Thank you.